Hello, I'm Kim Bassett, President of St. Joseph Medical Center here in Houston, Texas. And thank you for joining us for this virtual town hall meeting. We're hopeful that this is one more way that we can better communicate with our employees and our physicians about all the great things that are happening here at St. Joseph Medical Center. Boy, have you felt busy lately? Because we have been crazy busy. I know you're feeling it. I'm feeling it as well. We've had a lot of new physicians join our medical staff, some orthopedic surgeons, gastroenterology, pain, to just mention a few. And we are pulling in volume and transfers from all over the state of Texas. Your hard work is really being recognized throughout the state of Texas. Congratulations and great job. One of the things I want to talk with you about is the investment that Steward Healthcare is making to our campus. We've been working with our board to develop a master plan for our entire campus, and you're going to hear a lot about all the renovations that have already started and will be continuing over the next several years. Steward Healthcare and your board are very concerned about our safety and well-being of our employees and our patients, and so many of these renovations and upgrades will improve the safety, the efficiency, and update our technology here at St. Joseph Medical Center. We'll be updating the facades to our emergency department and our women's center to improve lighting and access to those areas. We'll be adding new security cameras and updating the security camera system throughout the facility. And there'll be a lot of new IT infrastructure that's going to improve our Wi-Fi access, staff communication systems, and our patient call system. These renovations are going to create a more modern and state-of-the-art environment that are going to benefit both patients and staff. Now Scott Flowers, our Chief Operating Officer, will give you some updates on all of our renovations.
Hi everyone, I'm Scott Flowers, Chief Operating Officer at St. Joseph Medical Center. I wanted to share a few exciting updates that we have in store for our campus over the next 2 years. Steward has invested about $80 million in our campus renovation at St. Joseph Medical Center. Very exciting. The highlights of that, many patient-facing areas will be completely new. We're going to rebuild different areas, patient care units. All the med-surg units will be new units. We have a few other places, areas that will be visitor-facing, such as the cafeteria and some other key areas that I'll talk about in just a minute. So a very exciting time for St. Joseph. We have renovations in our emergency room, in our women's ED, our women's OB area, also in our pavilion. We are doing some great renovations in there. And so I'll give you just a brief highlight of those. Phase one of the renovations actually began at the end of February. Phase one is going to be 2 new cath labs. It's going to be a new interventional radiology lab, new mammography unit as well. Those will be in the pavilion on the 2nd floor in conjunction with outpatient imaging, where radiology is currently located. Another very exciting component of phase one is the build out of a new urgent care center, which will be on the ground floor of our pavilion building. Really important aspect for the future of this medical center is access to urgent care. And so that's going to complement our services at St. Joseph very nicely. Another part of our renovation is going to be a psych-safe ED space. So our plan is to take the fast track area of the existing emergency department and create that into a psych-safe space, emergency department, for behavioral health patients. And so that will provide a great level of care for those patients in a safe and friendly environment. The ground floor of our women's building, we're in the process also of building out an OB emergency department for women so that they can report there and present there rather than going through our main emergency department and then being transported there. So very exciting campus renovations. The next part of that, I'll talk just about the cafeteria. We are relocating and building out a beautiful new cafeteria. It will be on the 2nd floor crosswalk area where all of our crosswalks converge, which currently is where our cath labs are. So after we get the renovation and build out of the cath labs, which should be completed by about October, November of this year, of 2021, then after we swing those spaces out, we'll start the construction of the new cafeteria. There'll be a small auditorium behind that as well. But it'll be a complete new food service build-out. Cafeteria and patient food service will be behind that. The total renovation timeline is about 2 years. It's going to take 2 years to build out. It was initially designed in 4 different phases just because we had to swing departments, build out, and then swing to another area. And so we're working through those logistics now. Many people may be moving departments. Administration is one of them. We will be moving this summer, as a matter of fact, into the George building so that we can build what is now administration will become a patient care unit. There will be patient rooms where we are located now. So very exciting. I think this is a much overdue, long overdue, but very exciting facelift, if you will, and campus renovation project for St. Joseph. And everyone will see really, I think our patients and our visitors as well as our staff will really appreciate the amount of time and energy that's gone into this renovation. So we're looking forward to it.
Thank you for participating with us in this first virtual town hall meeting. We will be continuing these virtual town hall meetings, so if you have questions that you would like us to answer or suggestions for future topics, please send them to the email address on the screen. Thank you very much.